Welcome to SimplyRN. Today we will go over the differences between peripheral arterial disease, or PAD, versus venous insufficiency. For more details on each condition, please refer to my separate videos on the two topics. PAD and venous insufficiency mostly affect the lower legs, and as the name suggests, PAD affects the arteries while venous insufficiency affects the veins in the lower legs, and is also referred to as chronic venous insufficiency or venous stasis. The primary cause of PAD is atherosclerosis, which is plaque formation in the arteries, resulting in lack of blood supply to the lower legs. Venous insufficiency is caused by increased venous pressure from conditions such as prolonged standing, like working as a bedside nurse, obesity, deep vein thrombosis, and etcetera. All of these conditions create a high venous pressure, and veins are having a hard time returning blood to the heart and lead to swelling in the lower legs. Signs and symptoms reflect on the pathophysiology of both conditions. For example, patients with PAD usually present with skin that is cool to touch, taut, and shiny, with hair loss in the affected leg due to decreased perfusion and nutrients. There are also diminished to absent pulses and decreased capillary refill. On the contrary, skin in the lower legs in patients with venous insufficiency may appear reddish-brown, thick and leathery due to leaking of serous fluid and red blood cells into the surrounding tissues. Both PAD and venous insufficiency can cause ulcers in the lower legs. Arterial ulcers usually occur in the toes and on top of the foot, because these areas are more distal and therefore receive less blood supply. Arterial ulcers are small, deep, and less likely to bleed. They have a round edge with a punched-out appearance. They may appear pale, pinkish-colored due to poor blood supply, or they may be black if there is presence of necrosis. Venous ulcers typically occur over the medial malleolus, or the inner side of the ankles, because that area receives the most pressure due to gravity, and is also pressing on the ankles, which are bony prominences. Venous ulcers are larger, more superficial, more likely to bleed, and have irregular edges. Both types of ulcers can cause pain. Pain caused by PAD is sharp and occurs in the calf or from ulcers. It is called intermittent claudication that worsens with exercises and elevation because this will further impair arterial blood flow. And pain is usually relieved with rest and dangling the affected leg because gravity helps with circulation. Patients with venous insufficiency can also experience pain caused by swelling in the affected leg. But unlike PAD, pain from venous insufficiency is dull and worsens when the affected leg is in a dependent position, such as sitting or standing due to increased pressure from swelling, and improves with elevation, which relieves the pressure from swelling. Pain in venous insufficiency is not associated with exercise. Nursing interventions. Nursing interventions for both conditions focus on patient education. Both PAD and venous insufficiency should avoid the 5 C's. No crossing legs, no cigarettes, no caffeine, no cold temperatures, and no constrictive clothing. Constrictive clothing refers to tight garments that put pressure on the whole leg, which is not recommended for either PAD or venous insufficiency. This is different from compression stockings, which apply graduated pressure that is much stronger at the ankles and become less as they move up the calf. Patients with venous insufficiency should wear compression stockings to prevent dependent edema, while patients with PAD should avoid them because they can slow down arterial blood flow. And patients with PAD should also avoid sequential compression devices and elevation of legs for the same reason. Besides wearing compression stockings, patients with venous insufficiency should also elevate legs above heart level for 20 to 30 minutes at a time to relieve swelling, and they should avoid prolonged sitting or standing. Thank you for watching this video. Make sure to check out my study guides by clicking on the link in the description. As always, this video is for educational purposes only and not indicated for clinical use. See you next time.